we're just kind of tapping the tip of the iceberg, I feel like. I mean, there's so many avenues that you can use Udo just because we have a collaboration piece. And so there's a hub, and it's super easy to use. It's easy to implement, but it's basically a hub that invites all the families, the patient, and all the providers and people that are taking care of the loved one all in one case. And so now we have a library of videos that's pre-recorded. We set up one time. So I had a video that I do my introduction. And before I do it, only reactively. When families come and ask me a question. And now I have that proactively. So I created this library. It took me about 2 minutes to create. And now I had over 200 conversations since the library came out 3 weeks ago.
Wow. So you've created
or 4 weeks ago.
So you've created this video one time, and that conversation now has started over 200 times in 4 weeks.
Exactly, to family, patients, and all our staff too. So they're being educated too. I had one of my staff members say, "Oh, I did not know that about Medicare and how that works." And it's amazing that you can educate and show everybody that's invited to that case sees that. And so it's so powerful. So there is literally zero lift on my side. I recorded a simple conversation that I have multiple times every week, and now that's been duplicated to every one of our patients. So now we're being proactive and giving them all the information they need, and it's been great.
And so this is kind of an introductory video that you have recorded and put into the Udo library.
Yeah.
What are you putting into this introductory video that's making such an impact on everybody?
Well, really, it's just orientation. So there's a lot of fear right now in healthcare. So people are just fearful. So people come to our facility as a reactive situation. So their mom falls down, they're thinking they're going home, and then all of a sudden a doctor makes around and says, "Nope, you're going to rehab." So now they're coming into a facility. So there's a lot of fear kind of building up. What does a rehab look like? What are we going to do? And so when they come into our facility, we have 9 pre-recorded videos from our physician talking about how many times he rounds, how often he visits with the loved one, to our dietitian, to our transportation to a doctor's appointment, to insurance, explaining the insurance process, to our charge nurse. My piece is sharing about how Medicare works and the benefits that you have along with that. And so all those videos add up to be a huge gold nugget for the family. Now they understand what we are, and they understand why the doctor referred that patient to our facility. And then the fear level is just dropped completely off.